going to come next to you, Phil, and just talk about, is there a role here for AI? Obviously, we know that AI is well suited to very complex problems, and this is for sure a complex problem. So,
Yep.
is there a role for that in helping advance our understanding of mitochondrial diseases and helping to fine-tune diagnosis
Oh,
process?
100%. I think artificial intelligence is going to touch our lives in many different ways, but in the context of rare disease or medical care or even mitochondrial disease, all the complexity, right? We talked about where it can be very hard for humans to be able to connect all the dots, right, and see the patterns. This is what artificial intelligence actually excels at. Um, I know we're starting to use artificial intelligence agents like large language models to interview the patients as part of our genetic testing program and then registry, because having a conversation, right, is a much more productive way for the patient community to feel like they're being heard, right? As opposed to a survey with very specific questions, and it may not be perfectly suited. So the ability of AI to pivot and rephrase and dig deeper, it's human-like, right? I think this is the reality that we're facing here. So I think all of this will lead to tremendous advancements. And I haven't even touched on the use of AI from a drug development perspective. I'm a chemist by training and worked in drug discovery. Anybody involved in drug development would say it's a somewhat irrational process. There's such a huge landscape of where drugs can be, and we do a lot of testing, and it's not very rational all the time. We're just throwing things against the wall, right, to see what works. AI can open the door, right, to start making those connections and be more rational in how we do drug development. So I think all of this will ultimately be of benefit to our patient community.
So this could be the next big milestone, couldn't it be the application of AI and what that will do to transform in that next 10-year period?
It's not an overstatement to say it will revolutionize. I
Yeah.
think you appreciate that.
Yeah.
The field, but probably in ways we can't even imagine right
Yeah.
now. And certainly I haven't been able to articulate. Those are just a few examples right now. But the future is both exciting, but also uncharted.
Yeah, absolutely. And Maria, let's talk a little bit about funding research. I know that all organizations here are heavily involved in that. What do you see as the current gaps looking forward and reflecting on what's the most urgent need of attention in terms of research funding? Where should that priority lie?
Yeah, it's a really good question. While we've come really far in the last decade of mitochondrial disease research, there are probably unsurprisingly several critical gaps that do require attention. For patients, understandably, there's a need for development of effective disease modifying treatments. Bridging translational research to clinical applications will be absolutely essential to discover novel therapeutic candidates. And this will also help in enhancing early diagnosis, which we've obviously spoken a lot about today, which is another area of priority. And delayed diagnosis remains, as we've said, a significant challenge for patients, often due to the non-specific and multi-systemic nature of the symptoms. And it's therefore absolutely essential that we improve early diagnostic and prognostic tools to predict disease progression and also guide clinical management in the future. Phil sort of touched on this a little bit already, but clinical registries are an area of attention also. Having standardized registries for mitochondrial disease are urgently needed to collect longitudinal data on patients and improve our understanding of natural history, identify genotype phenotype correlations, which Phil also touched on, and really support that clinical trial recruitment for patients. To then actually support clinical trials further, we urgently need standardized, validated clinical outcome measures that are specific to mitochondrial diseases. And these are essential to capture the impact of the disease and treatment comprehensively, because they provide objective and reproducible metrics to actually evaluate the effectiveness, safety, and impact of a clinical intervention. On a, I guess, more basic level, obviously a deeper understanding of mitochondrial dysfunction is needed, and particularly focusing on factors which can contribute to things like disease onset and also progression, how the disease is progressing. And within that, improved animal and cellular models will be absolutely essential for this work to bridge that gap between basic sort of lab science and then the clinical applications a bit further down the line. And finally, like international collaboration, it needs to be supported, championed, which hopefully we've sort of really spoken about today, to really pool those resources, expertise, and patient data where we can to accelerate the progress in the field. And hopefully prioritising research in these areas will not only advance our understanding of mitochondrial disease as a whole, but actually improve the outcomes for patients worldwide, which is ultimately what we all want.
While we're with you, Maria, I want to touch on one of the questions that's come in from one of the listeners. And they've said, do you think the clinical variation in mitochondrial disease presentation is a barrier to obtaining research funding? It's a good question.
It is a good question. Potentially not an easy one to answer either.
Yeah, no, quite.
Yeah,
and if anyone else wants to jump in and help Maria out.
Feel free. Yeah, absolutely. Bail me out. But yeah, yeah, absolutely. I would say, especially for the more rare mitochondrial disorders, you know, if you have quite a small patient population, trying to actually get research funding for that area is really difficult, because often you see that a lot of research funding is looking to kind of benefit the most amount of people, which makes sense, I suppose, in terms of, you know, a lot of these sort of funding bodies are businesses. So often trying to kind of persuade that this is going to be worthwhile and this money is going to really help can be a lot more difficult than maybe more common diseases like cancer that, you know, affect millions. So I would say from that perspective, definitely. I don't know if anybody else has anything to kind of add.
I know I would be interested to hear what Amel has to say on this, but from my perspective, again, over multiple decades, the sense I have is that in the early days, complexity was born almost like a badge of honor. Look at this tough thing we're working on, and nobody else understands it or is looking at it, and we're helping the patients. Fine, right? That served this purpose in the early days as a rallying call, right? To unite, to come together, pool resources, advance the entire field. But we're at a point now where we know much, much more about the science, the disease, and ultimately the diagnosis of the patients. We're going to have to shed that legacy of complexity as a badge of honor and say, no, what are we going to do, right? To clarify, right? To define very clear patient cohorts. Maria spoke to the importance, right, of well-characterized patients in registries clinically and phenotypically and genetically. So we have to work to almost create shovel-ready projects, right, for the pharmaceutical industry, because, you know, to drug developers, complexity is a danger sign unless we can show clear pathways of understanding of progression of disease and the way the patients can benefit from it. But I'm sure Amel has more to say.
No, I think it depends on the disease we're talking about. I think for some of these, diseases, complexity is helpful in research, and in some instances, you need to have a broader perspective of the whole group of disorders. It's really hard to answer this question with a straight answer because it really depends on the funding opportunity, it depends on the body who's reviewing the project. It depends on the stakeholders that are going to work on the project. There are instances where you really should go complex and very rare, and others where you include everyone. And the good news is that because mitochondrial dysfunction is ubiquitous in many common diseases and other neurodegenerative diseases, we can always argue that we're doing this for a small rare disease group, but the benefit is going to be global for everyone with diabetes, heart disease, Alzheimer's, Parkinson, everyone. So that argument, we should take advantage of that.
Absolutely. I'm really mindful of time, and I think we're going to go over a bit, but I just want to come to you all and ask you if you could give me one priority. So thinking about going back to where we started, which was the challenges of and the sort of landscape of advocacy groups. If you were to think of one priority or one wish from an advocacy group perspective or from your perspective that you'd like to see happen, what's your one key priority? And I'll come to you first, Philip.
jump in. Yeah, I would say if I had to pick one, I touched upon it in my previous comments of sort of changing this mindset, right? Of, oh, it's so hard, it's so complex, we can't, right? And there's no question we face many challenges, right, in the care of the patients and developing therapeutics for them. But it's actually a very exciting time. And in this kind of panel, I always like to end with a message of hope for the patient community. There are many therapeutics in development. There are even many more preclinical that are in development. And these are going to be meaningful therapies, right, for our patients. So I think preparing for success, the patients understanding the importance of being engaged in clinical research and the role they can play, right, in success, for the clinicians in working on very focused projects, the so-called low-hanging fruit, to have success, because a little bit of success is like a flywheel then, right, to more capital being invested into the mitochondrial disease community. So for the patient advocacy groups, it's the same thing. A new world is ahead of us. We're going to have to continue to evolve as therapies are reviewed. Now the challenges of access and paying for the drugs, et cetera, you'll all come to the forefront. So I think for all of the stakeholders, there's still a lot of evolving to do.
Thank you. And Amel, one priority for you, what would you put that as?
So for me, not being an advocacy group, the priority I see is that all advocacy groups need to collaborate. And when I say collaborate, is not just saying, yeah, we're all friends and we want to work together in the sandbox, but truly collaborate. As we've heard, it's complex, it's rare. There's no one advocacy group that can do it alone. And we don't want advocacy groups to start splintering where every parent with one gene disease starting their own advocacy group. So really coming all together, keeping their identity, but putting funding together into common project, doing natural history in the same databases and doing all that. I think that is going to move the field a lot further and a lot faster.
Amazing. That's really important. And Paula, what about you? One priority.
I can't separate funding from from education. I think funding is very, very important, but at the same time, we need to keep educating people, doctors, and the public awareness as well, to know about mitochondrial diseases, what they are, and the fact that they really cover so many different muscles, organs, and so many other, so many different diseases. So I think both of them are equally important: informing, educating, and funding.
Thank you. And Maria, to you lastly.
Yeah, I think I was also going to say what Amel said, so she stole my answer. I was going to say establishing collaborative research networks, I think, is absolutely essential. But if I had to say something else, I think a sort of a close second is really sort of establishing and then supporting extensive clinical and genomic medical databases. And these resources are urgently needed to support clinical trials, research, and inform the design of clinical trials by patients as well. So I would say that's my close second.
Amazing. Thank you. I've just got it as a question I think we haven't answered in the conversation yet that I want to come to, that's come from somebody listening, which is a really good one. What piece of advice do you have for middle income countries that do not have access to diagnostics yet? Where do we need to start working to help patients to get access and clinicians to be more aware of mitochondrial diseases? Anyone want to jump in and take that?
I can try. It's a tough one. I think one of the easiest path right now is to collaborate with some research center to try to send in samples and to try to do more testing on a research basis. There are also some commercial labs that might offer discounted pricing for other countries. And so these are the two venues. And I would say, if you can get to conferences and meet people, try to do that, even if it's just remotely. That can help open doors and help with getting to know people, networking, and collaborating.
Amazing. Thank you. We've also, just to let you know, had some lovely comments coming in for people saying how helpful they found this. A parent with a child with mitochondrial who's found this incredibly helpful for them, and just people appreciating you all giving the time to shine a spotlight on it. So, really great to have been able to share what I think has been a really good conversation, covering quite a lot and certainly digging into the complexities of it. So thank you all so much. I mean, as someone who's spoken to you before, it's been really lovely to revisit the topic. Really appreciate your time. So big thank you to our speakers. Of course, thank you to UCB for helping us facilitate this conversation today. And thank you to everyone who's joined and asked questions. Hopefully we've managed to weave them in as best I can throughout the session. If there's anything we haven't picked up, we will follow up afterwards and send out to anyone, but I think we've got it all there. Just to let our listeners know that the webinar will be available on demand for anyone that you know that might be interested that join the session in a couple of weeks on our website, and you'll be shared across our social media. So there'll be plenty of opportunity to catch this or revisit it if you've heard it, but you want to listen back. So please feel free also to reach out shortly when we end. There'll be some contact details on a slide. So we always love getting feedback, or if anyone's got any further questions for the panelists, you can use that for getting in touch. In the meantime, thank you all so much. I've loved speaking to you all, and have a great rest of your day.